Hello, I'm Sheila Davies, Director of the Dare County Department of Health and Human Services, and I'm joined today by Dr. Christian Legay. Dr. Legay is a practicing pediatrician and owner of Surf Pediatrics and Medicine in Dare County. As new cases of COVID-19 continue to increase in Dare County, the best guidance to protect yourself and others is to get vaccinated if eligible and follow the 3 W's: wear a mask, wait 6 feet apart, and practice good hand hygiene. Given the importance the COVID-19 vaccine plays in helping us combat this virus, I have asked Dr. Legay to join us today and answer some questions the public has raised about COVID-19 and the vaccine. Dr. Legay, thank you so much for joining us today. I know you all have certainly been very busy, so I appreciate you lending your time today.
Of course, thank you very much for having me.
So there's some mistrust over how the vaccine was developed, the speed in which it was produced. Terms have been used like experimental vaccine. Could you share some information about how the vaccine was developed and maybe what you would say to a patient who's on the fence about getting the vaccine?
Sure. Well, the mRNA vaccine, which is the new vaccine that Pfizer has made and Moderna has made, is a really cool way to make the vaccine. The technology has probably been around for about 20 years now. For people who don't know, the cell in our body, the individual cells have a nucleus, they have DNA and RNA. The DNA is inside the nucleus, the mRNA is outside of the nucleus in the body. So DNA tells RNA what to make, RNA makes a protein and sends it to the body and it does its job. So the scientists who have come up with this, who are quite bright, and it's really cool, they have made an mRNA molecule that has part of the spike protein of the coronavirus in it. And in the shot, they send that into the body, it attaches to the cell, it goes into the cell, not into the nucleus where the DNA is. It makes a part of the protein of the coronavirus. The protein comes out into the cell wall, and then your body makes antibodies to that and then stores that for later. So, it's a new therapy, but the technology has been around for 20, 25 years.
Right. And just to reiterate one of the things you said, so it doesn't enter the nucleus of the cell, so it can't alter your DNA. That's one of the concerns that people raise.
Exactly. So mRNA is outside of the nucleus, it's in the body of the cell. So DNA is inside of the nucleus. So the vaccine cannot alter your DNA.
Another common comment that we've heard is that individuals feel like they're healthy enough on their own. They've got a really robust immune system, they never get sick, so they don't need the COVID-19 vaccine. And we've also heard people that have said, oh, I've had COVID-19 and it really wasn't that bad, so I don't need to get the vaccine. What would your advice or guidance be to those individuals?
Well, the virus, any virus can affect anyone. And we don't know how it's going to affect whether or not we're healthy or not healthy. So it's really important for all of us, at least at this point down to age 12, to get the vaccine. This is a public health issue. So we are protecting ourselves, but we're also looking out to protect everyone else in the community. So it is a personal issue, but it's really a public health issue. So we need to do it for ourselves, but we need to do it for our children, our grandparents, everyone else.
We've also heard some concerns or people claiming that because there are now breakthrough cases, that's an indication that the vaccine's not working. Can you tell us a little bit about that?
So the vaccines are made to protect us against the virus. So when we get a vaccine, we get 2 doses and we have protection. It doesn't necessarily mean that we cannot get the virus even though we're vaccinated. So I think there's a misnomer about vaccination and what's called herd immunity. We need to get everyone vaccinated to get to herd immunity so that our population becomes immune to the virus itself. So because we get the vaccine, it doesn't necessarily mean that everyone is not going to, if they get exposed again, will not get it again. The hope is that if you get the vaccine, you are not going to get as sick and or hopefully will not have to go to the hospital if you get it again.
Right. And that's certainly what we're seeing in Dare County with the cases that we've had, the breakthrough cases. The reports when we do interviews with those who have been fully vaccinated and get COVID-19 or test positive for COVID-19, their reports generally are mild symptoms. Some of them are asymptomatic. We've had a few that have had moderate symptoms, and there's been one hospitalization, but certainly the vast majority are mildly symptomatic, which is great, which is an indication that the vaccine is doing what it's supposed to do.
Right, and if you look across the community, across the country, the grand majority of people who are getting infected with coronavirus with the new variant, the Delta variant, they are unvaccinated folks. The people who are getting it and being put in the hospital or having secondary complications are unvaccinated people.
Right. So other concerns that have been shared with our department include people are concerned that there may be microchips in the vaccines. The vaccines can cause serious long-term side effects, even claims about concerns with fertility. Any guidance you can provide on those topics?
Well, like we had spoke about before, the vaccine does not enter the nucleus of the cell and affect our DNA. So it cannot alter our person the way we are genetically. When it comes to questions of political motivation and or microchip or that type of thing, there's no evidence that the vaccines have, that these are the reason why we are doing the vaccine. I will say that if you look at social media, you look at the internet, the first thing, if you look up lots of different things, the positive things a lot of times don't come up, the negative things come up. So you really have to educate yourself and make sure when you're looking at the internet, when you're reading stuff, you know what you're reading, you're looking at good sources so that you're not swayed one way or the other and not understanding what's going on.
Right. And so to that point, there is a lot of misinformation, and early on there was some misinformation specifically about fertility concerns. But as more and more studies and research is done, the scientific body of evidence shows that there's no concerns with fertility related to the vaccine.
Right, so presently there are no concerns with fertility. They even have recently put out that they would like pregnant women to get the vaccine. So we are understanding more and more about the vaccine. We are getting more and more doses out there and understanding the safety part of things. And we are understanding that it is a lot safer as time goes by.
What about people with underlying health conditions? Should they get the vaccine? Or are there any concerns with them getting the vaccine?
Yes, they should definitely get the vaccine. They are one of the high risk or the high risk group that we need to protect. The CDC and the FDA have recently put out that there's possibly a booster dose for that group. So a third dose is going to be added to a select group at this point because of the need to vaccinate that group.
Lastly, there's been a lot of controversy over masks, whether masks are effective or not in helping us reduce the spread. Would you be able to comment on that?
Yes, I think there is a good amount of data out that does say that masks do protect person and really what we're trying to do is protect others if I wear a mask. If you look, and I don't know if many people have seen, if I sneeze, the amount of particles that come out, it's millions and millions of particles. If you put a mask on and sneeze, it very much decreases the particle spread. So from a common sense standpoint, it should and it does decrease the infectious part of things. I think masks are an easy thing to wear. I think we're doing it to protect the community. I know the schools here in Dare County, it's an option. I think it's really important that parents want to protect and keep their kids well, and one way is to have them wear a mask during their transitions in school. I think kids should go to school. They need to go to school. But I think wearing a mask in the times when they are asked to wear a mask is going to protect the kids, definitely at school and or in the Walmart and the other places where we go around the community. I think using it and taking it off when you go outside.
Is there anything else that you'd like to share with us?
Well, again, I think people need to understand how important vaccines are. I'm a pediatrician. I am biased in the fact that I think vaccines are one of the top 5 inventions ever in medicine, and it has saved millions and millions and millions of children's lives throughout the years. And this is a time when we need to make sure that we vaccinate ourselves, vaccinate ultimately our children to put an end to this virus, hopefully. There are still a lot of questions. I think we need to continue doing research and following and tracking this, but if there are questions out there, people can come talk to me, they can talk to their doctor that they see, but ask some questions and educate yourself.
Thank you so much for your time and for all that you're doing in our community and your practice. I know you guys, again, are really busy. Cases have picked up in the pediatric population, so thank you.
No, thank you.
Please, if you're eligible to get vaccinated, don't delay. Vaccines are readily available throughout our community. You may register right now online at darenc.com/COVID vaccine, or you may call an area pharmacy. Please help protect yourself and others from the spread of COVID-19. If you have questions regarding COVID-19, you may also call the Dare County COVID-19 call center at 252-475-5008. Thank you.